It happened while I was at work. I work at the Menards Distribution Center. I'm in the transportation area, and one of the things that we work with are the outside yard horse drivers who move the trailers around the yard. They started calling on the CB that something was wrong with Dave because all of a sudden his truck veered off into the ditch.
I was at work and received a page of a unconscious, unresponsive male just outside of our gate on Kane Road and Menard Drive.
One of the guys was able to get to him right away and get the truck stopped, and called back and said that Dave seems to be having a heart attack or something's wrong. So as soon as I heard that, I left the office and started heading down there. They were working on getting him out of the truck. By the time I got there, between all the yard horses that had stopped to help, they had him out of the truck and on the ground to where we could start CPR. So then I checked him out. I couldn't find any signs of breathing or looked for a pulse, and there was nothing.
As Alf spoke with Kinstler on the phone, he quickly analyzed the patient's symptoms.
I could tell that he was most likely in cardiac arrest. He had just given his last agonal breath, and he was blue in color, so I knew he hadn't been breathing. So before I could get there, I just yelled at Darren, "Start compressions," and he did.
So between the two of us, we started chest compressions, and then shortly after that, Joe Alf arrived.
Started getting equipment set up. I applied the automatic external defibrillator. It showed a horse V-fib rhythm. AED recognized that as a shockable rhythm. Charged, we shocked. We continued CPR immediately, and within the 2 minutes, we started to notice electrical activity in the heart rhythm. Also noticed some spontaneous breathing occurring, and within that 2 minutes, we were able to stop compressions. About another 2 minutes went by. The patient started breathing on his own continuously. The paramedics arrived, had all the hard work done for him. They started an IV, gave some medications, and our patient started talking to us.
To me, it was something that I would hope anybody would do for me if I were in that position.